Hi, this is Dr. Richard Eby with Eby Foot Care. Happy New Year 2017. This is our first video of the year, and as many of them we've done in the past, we've got an ingrown nail. This is a mild ingrown nail, left big toe on the lateral side, so it's on the side that the second toe touches. Very mild one, but it's given her trouble off and on for quite some time, so she has decided to have us remove that part of the nail and to kill the matrix or the root behind it so it doesn't come back. This side of the nail is basically normal, and up here we can see just a little diagram of what we're talking about. Again, the second toe would be right next to that. So we're talking about, okay, so this just gives you an example. This is the great toe or big toe. Second toe next to it, there's the part that's ingrown, and the matrix or root is located back here. So we're going to start out by numbing the toe at the base of it. There's actually 4 areas we're going to numb. We're going to go down one side, the other side, across the bottom, and across the top. We actually only have to usually do 3 needle sticks. Might seem like a lot, but actually this will numb the entire toe, which makes it that we don't have to put any anesthesia right here by the nail. This is really one of the worst places to get an injection, also the tip of the toe. So where we're going to give it, not painless, but not really too bad. And after we numb the toe, we'll give it about 5 minutes to get numb, scrub the foot with an antiseptic, and then we'll actually remove the nail. So let's get started with the injection. Lay you back a little bit so you don't have to watch.
Where's my handle?
Okay. We need some cold spray. And I find it's best just to put your foot straight down. There you go. Got cold spray?
I think just one moment and I'll grab that.
Okay.
Okay.
Where it's ingrown, a little behind it. Cold spray. Okay, good. Little needle stick. So although we inject 4 sides, we're actually going to put more on this side than the rest of them, since that's the side we're going to work on. You're doing fine. Almost done with the first side. Okay, now I like to come up to the top. Let's go ahead and do the other side. We'll just do that and then we'll go across the top. Try number 2. Good. This side will take quite a bit less. And then while I'm here, I'm going to put a little bit right across the top. So you see, we didn't remove the needle and put it back in. So now we should basically have 3 sides out of 4 anesthetized. Of course, it'll take about 5 minutes to be complete. Last one we're going to do is right there. We're going to do some cold spray again right there near the bottom. Okay, good. Little stick. And sometimes the cold actually hurts just about as much as the shot, but it helps for when the needle first goes in. You're doing really well. We're like 80% done. Got to do a little bit going toward that lateral side. We're about 90% finished. Hang in there about 10 more seconds or less. And I tend to put a lot on the bottom and a lot on the side where the nail's ingrown. And I find you don't need it as much in the other areas. And that should totally numb the toe. That should numb it that we could do basically anything to it from here on up and she wouldn't feel it. So we're going to give it about 5 minutes to get numb. We're going to scrub the foot, and then you should already feel a little difference. Okay? Okay, we've got the toe numb. First I like to make sure, and that we're going to take this pickup or tweezers, and you should feel me moving it. Nothing should hurt.
Nothing hurts.
Okay. Next, we use a tourniquet. This is called a tourniquet. It's just the right size for the big toe, and not only does it keep it from bleeding, it actually pushes the blood back, so we get very, very little bleeding. It's important we do this, that we don't have bleeding when we put the chemical in there to kill the root. Okay, so we're going to start now to loosen up the nail. We have what's called a freer elevator, and we're just going to lift it. And again, you should feel just some pressure. This is the part of the procedure that would hurt the most if it wasn't numb. A lot of it would not really be that bad, but loosening up that part of the nail is what you would be feeling. Then take a nail splitter, which is to cut through the nail all the way back toward the matrix or toward the root. And we're going to take more than what's ingrown, because a lot of times if enough nail is not taken, the skin will grow right back up against it, and it'll feel like you still have an ingrown nail. So we're actually taking a little extra. It's important that it go all the way back to the matrix. Again, if we didn't have the tourniquet on here, we'd be getting some bleeding. It wouldn't be a tremendous amount, but it would be a lot more than we're getting now. And it wouldn't be a problem if we were doing it temporary. But since we're doing it permanent, we want to make sure it doesn't bleed when we actually put the chemical in there. So I just tried to make sure there was nothing in there blocking access to the matrix or root. Just going to file that edge where it's a little rough. Sometimes I like to also dry it. And then we're going to start cauterizing it. We use a chemical called phenol, which is a strong acid. It's also possible to use sodium hydroxide, which is a strong base. So if someone can time 20 seconds for me, start now. I really think it's important to time how long this goes in. And I like to do it 5 times. Maybe a little longer than it's done on average. But the chance of it coming back when you do 5 applications for 20 seconds apiece, I find is very, very unlikely. Less than 1 out of 100. We sometimes will curette it between applications, again, just to make sure there's not a little piece of nail or some dead skin in there blocking access to the matrix. Number 2, 20 seconds, start now. And again, the area we're applying this is just right under that fold of skin.
Time.
We'll go right on and do the third one. Phenol is a very caustic chemical. If you get some of this on your skin, start now, number 3. You'll get a little red spot. So we want to make sure we get enough, but not too much. And again, you'll notice most of it I'm applying way back in the area around the root or matrix.
Time.
This just happens to be one that's not infected. A lot of times when we do these, they're infected or they have been infected. Number 4, start now. So we're not using any antibiotics. Except for a topical one that we'll apply at the end.
Time.
One more. And I'm going to just file this again just a little. Can't really tell you how many it takes to cauterize or kill the root. 3 of them might do it, might take 4. Start now, last one. I just find when you do 5, it's extremely rare that nail will regrow. Go any more than 5 and you're going to really be burning it a little too much. And you'll notice as we've done this, there's no bleeding. The toe is white because of the tourniquet. We're now going to switch over to just plain old isopropyl rubbing alcohol. This actually helps remove all of the phenol that we put in there. It's actually done its job. This can also be done by using a smaller amount of phenol and just leaving it in there, not washing it out. But I like to make sure I've removed every bit of it. So that's why we flush it over and over again. Okay. So now we've washed out all the phenol. It's time to put a dressing on it. And I like to start with a little iodine, povidone iodine, or used to be called betadine. Follow that with Silvadene. The generic name is silver sulfadiazine. And you'll notice when we take this tourniquet off, the color will come back almost instantly. You can see the color's back already. And now we have to kind of work fast to cover it up so we don't get a lot of bleeding. This is Telfa, which is non-adherent. So when she takes this off tomorrow, it's not going to stick. If I put this gauze directly on that spot where the bleeding is, she would not be very happy tomorrow when she removes it. It would be stuck. There is an easy way to do that if it happens. Just pour peroxide on it, but you shouldn't have to do that. Some of the earlier videos I had some comments saying that I put too much gauze on the toe. Well, I can tell you what happens if you don't put enough on. By the time the patient gets to the front door, it's already bleeding through the bandage. So I've done this a long time and I know how much we need, and we need quite a bit of gauze. And then we're going to cover this with something called Coban or Coflex, which is just to compact it a little bit. It's also important to put a little bit around the rest of the foot to hold it in place. And I'll have one of the assistants take over here and finish up the bandage. And she'll keep this on tonight, possibly put ice on it to keep it from bleeding through, keep it numb a little bit longer. That anesthetic we used is a mixture of 2 different local anesthetics. Together they're going to last about 8 to 10 hours, so she shouldn't have any pain here. It might be a little uncomfortable tonight, but it really shouldn't be too bad. But ice will help to keep it numb even longer, sometimes 11 or 12 hours, and will keep the bleeding down. Tomorrow morning all this stuff will come off, and either soak it, warm water, Epsom salt, or there's also a kit you can use to clean it, and a gel you can put on it, and a Band-Aid. Most important part of the aftercare is the Band-Aid. As minor as that may sound, if you don't cover it with a Band-Aid, it's going to scab over, get dry and crusted, and not heal the way it should. So that's basically it for another partial permanent ingrown nail removal. This one not infected, so we don't use antibiotics in this case. This is Dr. Richard Eby for Eby Foot Care. Again, Happy New Year 2017. If you like our videos, go ahead and subscribe and give us a little thumbs up. Appreciate that. and we'll see you with something other than nail surgery in the near future.